Okay, let's go ahead and begin. Hello, Doris. Okay. Okay, everybody know how to work their microphones? Once we hit them. Okay. Meeting of Wednesday, September 28th. And welcome everyone. And the first thing we do is a board member roll call. So I'm here. Doris? Here. Okay. Commissioner Bremer?
Present.
Commissioner Gonzalez?
Here.
All right. Good. Councilmember Donaldson? Probably soon to arrive.
I thought I...
And Dr. Richard Vu? Fire Chief Ted Colas?
Here.
Trustee Ron Stevens?
Here.
And General Jack Briggs?
Present.
Where's he? Welcome, sir. And our first action item is the approval of the agenda, which you have in front of you.
So moved.
Second?
Second.
All in favor?
Aye.
Aye.
Well, that was easy. Board of Health comments. And this is an opportunity for you in the audience where Board of Health members can talk about things that have happened since the last meeting or topics of importance that they may have seen in the news or pretty much anything else. So, Board of Health comments. Any?
Right here.
Yes, please. Our Chief.
Yeah, I just wanted to say thank you to the Board of Health staff. I had an opportunity on the 14th of this month to participate in their picnic, and it was just a lot of fun to get to meet people and say hello and share a meal with some folks. And then also on the 15th of this month, got to go down and get a tour of the fountain facility, and that was very interesting and informing. So thank you.
Great. Great. Good. Yes. Commissioner Gonzalez.
Just wanted to highlight the El Paso County. They did some grants, a little over $20 million for water and stormwater projects. I think some of those water projects will be going to also help alleviate some of the PFAS issues that we've seen. Everybody has clean drinking water down in those areas, but those costs associated with that. So some projects that I think are going to help the improve our water quality and infrastructure in El Paso County.
Didn't we just get a good report from EPA on?
Absolutely.
Yeah. Okay. This is worth highlighting.
Yeah. So that was actually a good transition. So we did see. So the county's putting some additional dollars out there, continuing to work with all partners. And one of the things they saw was that even though there is some concern. There is, of course, always concern if there's contamination for people who have had a long history of consuming those waters. That they saw that the effect on the people who had been living in these areas was not significant. So nothing is never not at all significant. Right. But it was the response or the report indicated that the numbers were good.
Very good report.
So very good report overall.
Well, thank you. Thank you very much. Hello there, Lori Seagull. Welcome. Welcome back. Trustee Ron Stevens.
Yes, I have a couple of quick comments. Number one, in our bylaws, it says that on September 1st, our new budget is supposed to be submitted to the commissioners.
Okay.
I wonder if it'd be possible for us to get a copy of that so we can review that. Yeah. So just have that available.
Good.
Also, I had a constituent send to me a email that they got from the Colorado Department of Public Health and Environment saying that they had signed a memorandum of understanding on advanced environmental justice through enforcement and compliance assurance in disproportionately impacted communities, assessing how we can increase total percentage of inspections conducted in these communities, coordinating response on tips and complaints receiving concerned potentials in disproportionately impacted communities. I guess my constituent was very alarmed, and I think the language that they were using, like environmental justice and social justice, is very vague, and it's not really clear. So my concern is if a program like this comes to our level down here, that we would be more specific in our language and say what that means. So if a minority community needs their restaurants to be up to the same standards as another community, I think we can all get on board with that. But my experience is that a lot of people with environmental justice don't quite understand economics, and their tendency is to regulate, and the economic impact of some of those regulations, if they're onerous, especially if they're onerous, would be more burdensome on the minority communities. And my concern is there would be layoffs in those communities, and there would also be businesses that could go out of business. And so we would be jeopardizing the success of those communities. So as long as it's not putting onerous things, so if something like this comes down to our level, I'd like for us to be very transparent and very specific as to what our intentions are in that regard. So I just want to put that.
Good comments all. We have a new environmental health director. You want to raise your? Okay, could you get that document to him, perhaps, to take a peek at?
Okay.
And then we'll see how that matches up with what we already do. And other Board of Health member comments about what Trustee Stevens just said. Yes, please.
Well, not about what he said, but just wanted to thank Director Whelan for inviting me to Colorado Springs I Love You event last night with the faith-based community. It was really worthwhile, and they talked a little bit about the social determinants of health and really steps that hopefully the faith-based community can take to solve some of the or come up with some solutions. And I thought that the Sanctuary Church pastor, Dr. Eric Sanders, talked a little bit about, just briefly about not only solutions or cures, but also a little bit about prevention. And I thought that was really neat to hear because he was the only one that even talked about prevention.
Great. That's good. Other Board of Health member comments? Yes, please.
Thank you. I was going to bring up the event that Doris just did as well. And it was a group full of the faith-based community and pastors from throughout our community. And it was fascinating to hear them really touch on public safety, schools, and mental health. And so those are huge intersections with the work that's done here with our El Paso County Health Department. And to hear a group of nonprofit organizations basically say, hey, government can't be the solution, regulation can't always be the solution. How can we work together for the good of the broader community? It was fascinating. I'm hoping to see some real action items out of that as well. And I would encourage Susan and her staff to stay plugged in to some of the efforts that really the nonprofit community is doing that really intersects very closely with the work that all of you do every day.
Thank you. Jack, did you have a comment? Yes.
I would just agree. Being in that sector last night was a really great affirming activity where you could see all the different elements of why Colorado Springs in El Paso County is special, because you won't see that same thing happen in a lot of communities where people just come together because it's the right thing to do.
Great. Sounds like a good meeting. Councilmember Donaldson.
I think
Up is on.
Yeah, thank you, Mr. President. My apologies for being late this morning, but I just came from a place where no matter how much we work on our health, no matter how much, we're all going to end up at some point. That is a cemetery, Evergreen Cemetery. And this morning, an organization, volunteer organization called The Looting Branches, they have a day of service there, and it's really local arborists, crews, parks, Black Hills Energy are there to help. They're going to trim lots of those trees damaged in storms. Just over the last 100 years, it built up. The trees trimmed. They're doing that this morning. It's a volunteer thing. You'll probably see it tonight. So, and kind of interesting come from Evergreen Board of Health. What we can, but eventually we're all going to end up like that. So.
Very uplifting.
Well, I would focus on the on the beautification part.
Absolutely.
and that not to get too far afield, but that's part of public health as well, is the the built environment and that it has an effect on public health. So
That does.
what you're speaking about, the beautification of part of Colorado Springs, is absolutely, I think that's, we can tag on to that. So thank you for those comments.
And again, this organization, Saluting Branches, they focus generally on military cemeteries. And because our city founding father, General Palmer, Medal of Honor winner, and there are many other veterans buried there, they can, it makes sense for them to help out with Evergreen, the oldest cemetery in the city, and really a beautiful place. I'd recommend take a morning and go down there. Spectacular.
Thank you. Thank you. Other Board of Health member comments? Dr. Vu?
No comment, thank you.
Oh, okay. I think I'm the only one left. Well, I did have a couple of things here. This is National Preparedness Month, and so we're going to be reading a resolution proclamation about that and introducing our new Emergency Preparedness and Response Program Director today. But let me talk about a public health threat that is not often discussed, and that is lack of electricity. And when the grid goes down, there's all kinds of secondary and tertiary effects, particularly for people who are reliant upon electricity for their health. So just a little bit of history. Hurricane Maria pretty much wiped out Puerto Rico for a long time, and they just got another pass, and large portions of Puerto Rico are still down. Cuba, of course, their whole grid went down. We have a hurricane barreling in on Florida right now. Floridians seem to know what they're doing pretty well. But Texas, a year ago during that ice storm, they had power down and there was some loss of life. California has at least two problems. One is from heat. There's been loss of life associated with too much heat and the inability to run air conditioners. And then, of course, the fires up north. That's related to the grid. So I would just highlight that for people as one more thing to think about when we are looking at individual and family preparedness. And Fire Chief and I were talking the other day on the phone, and I said, well, a generator would help with that. And Fire Chief's appropriate comment was, for people who have resources, that's right. But a lot of folks don't. And so we need to think about our wider population and the health effects of, loss of electricity, grid down situation. Okay. I think we're up to approval of the minutes. And board members, they were in your packet. You've had a chance to look at them. And recommendations for change. Otherwise, I'll take a move to approve.
If I could just
Yes,
add
please.
one thing to what you were saying about preparedness, electrical grid failures. As a member of the Colorado Springs Utilities Board of Directors, I think it would be good for citizens to know that if they do have a medical problem, here's a common one. Use CPAP, and it's serious. CPAP. Go to the website, the Colorado Springs Utilities website, find the number to call in there, just general contact number, and let Colorado Springs Utilities know that you have medical devices in the house that electricity will be prioritized higher in case of an electrical outage.
Excellent.
They'll get to that home faster. If we don't know that, you're just treated like everyone else. But if you do have medical electricity, immediately will be prioritized, and you're kept in a special.
Great comment. I didn't know that. I think also our city has statistically very, very few power outages, and they don't last very long. So we're in good shape that way.
That is very true.
Okay, we're back to the approval of the minutes. Motion to approve.
So approved. So
Second?
moved.
Second?
All in favor?
Aye.
Aye.
Okay. This is where we look to see, we'll ask if there are any public comments on items not scheduled on the agenda. Please come on up to the podium and identify yourself, and if you're associated with a group, please let us know that as well. Any public comment at this time? No? Okay. Finance and budget, and I think this is Samantha's opportunity to tell us about August financial summary, and can you kind of tee up our budget as well? Thank you.
Good morning, Samantha Montmany, El Paso County Budget Supervisor for Health and Human Services. So before you guys today is the summary of August expenditures, or year-to-date up to August. Again, everything is kind of coming in as anticipated. I'd like to kind of point out the license fees and permits. That line item, earlier this year, we're discussing how the state system kind of put us behind, and we were showing that we were definitely behind budget. At this point in time now, that has been corrected, and we are actually showing ahead of budget. So I just wanted to point that out, that it's been remedied, been fixed, and we are moving along just nicely with that. Again, some of the grants are coming in under, but they are reimbursement grants, and on the following lines, you can see the expenditures. They're not occurring, so we can't pull down the reimbursement for them. So overall, though, again, we don't have any concerns from budget. Any questions for me?
I think there was a question about annual budget, and if you can kind of describe the process that we go through and sort of the timeline of when that comes before the board and is approved.
Not a problem. So in October, I will be back and I will present to you guys your preliminary balanced budget. And then in December, you guys will approve your 2023 original adopted, and it becomes the original adopted budget.
Good. Thank you. Questions for Samantha, please? No? Okay. Thank you very much. The next part is approval of contracts. These are all renewals, and we used to do them sort of en masse, and because they were renewals, but we've taken to explaining them individually and let the program directors come up here and give a brief summary of the program. I will note that 3 of them have to do with moms and kids. And when I was in school many, many years ago, I was told by my public health professor that any program that promoted moms and kids was a good one. So with that kind of intro, let's go ahead and have, I guess the first one might be drug-free communities. Okay, great, thank you.
Is this okay? Hi, everyone. Heather Graves. I'm the Division Director for Community Health Promotions. I know that I've met you several times, and I actually will be doing all 4 of the contract renewals today. And so the first one we're going to do is drug-free communities. And I have Becca Barnhart here, who is a policy and prevention specialist that works with our Fountain Valley Communities That Care, where this grant or contract is up for renewal. The Drug-Free Communities Grant is a new grant for us, having just finished the first year. It's a 5-year cycle, so this is a renewal. It amplifies the work that we're doing in Fountain Valley with Communities That Care around opioid misuse and cannabis use, targeting our youth, safe spaces, building protective factors, education, and awareness. We have 4 staff that work in this program area, and some of our successes for this year was a drug take-back day and drug lock boxes, where we were able to, in the Fountain Valley, host this drug take-back day, take back 82 pounds of, 87.2 pounds of either expired prescription drugs, drugs that aren't being used anymore, and hand out drug lock boxes. That's really hard to say. I don't know why. And it was so successful that our partners in the Pikes Peak Library District in the Fountain Valley area decided to take that on as a permanent initiative. And they are carrying, financing, and holding these drug locked boxes for the community to come in and take at any time. And so that's kind of a brief summary. Happy to take questions. And of course, Becca is our subject matter expert.
Questions, board members? Yes,
I
please.
just have a general question on all these contracts. The indirect percentage, is it included in the contract amount or is it separate?
I believe it's included.
Okay, thank you.
Other questions from board members?
Yep.
Yes, please.
Could you explain for me, and I'm sure for some watching, what is an indirect percentage? How does that relate to?
The indirect percentage, and I may ask Deanne or Sam to speak to this.
So the indirect percentage, that is basically the overhead. A lot of the grants are able to pay for their direct costs, but they don't pay for anything above and beyond. So Susan's time, any supervision time of those sorts. So the indirect cost, if it's allowable in a grant, we do take that to help offset those costs as well.
This contract, that indirect percentage, 125.
Yeah.
So 10%, so 12,500 roughly.
Yes.
And that would be set aside for overhead, not for the actual programs of lock boxes, drug take back day, et cetera. So 10% overhead.
Correct.
Okay, great.
Other board member questions? Yes, please.
Thank you very much, and I want to commend the fact that this is education ahead of the game to get folks, particularly children, familiar with what drugs are and what they can do. And I'm going to show my my naivete, if you will, on as we have ballot measures and things that are going to be happening within the county and city. Does the board take a position? Do we take a recommendation on something like that? Again, and I'm reflecting maybe the naivete of the average citizen as to what leaders would do in a situation like this.
Okay. Well, I can speak from the Board of Health, is that issues that relate to Board of Health, certainly we're not reluctant to share our collective public health opinion with elected leaders. But maybe Commissioner Gonzalez, how do we work these issues?
We have in the past taken at least one when there was a change to the needle exchange rules. We did take an official position on that, and so I know that we can take an official position on issue if we wanted to. So if that's something that would be desired, I guess we can do that we could still do it in October. Elections in November. So we could do that, and we've done it at least once in my 5 years.
Yes, Lori? You have a comment on that? Go ahead.
I don't, but I can happy to answer any questions. Yes, the Board of Health is able to, as a body, take a position on any of the ballot issues. I would take this opportunity to caution you that there are very strict, however, campaign finance and campaign lobbying rules that as an individual, even as an individual Board of Health member, you cannot use county or Board of Health resources to advocate for or against any particular ballot issue or candidate. That's the Fair Campaign Practices Act. But as a body, you may adopt a resolution taking a position if you desire.
Yes.
And Mr. President, hey, I would strongly support Board Member Briggs' suggestion that we do take a position. It's interesting, we're talking about cannabis or marijuana right here, and there is a ballot initiative to basically legalize recreational marijuana in Colorado Springs. On City Council, I know it's perfectly acceptable for us to state support or opposition ballot initiative. We're going to do that in reference to that recreational marijuana. So I think it would be useful for Colorado Springs citizens to know that we, as a Board of Health, don't think this is unimportant or fast, that we come out and state we could have health risks.
Okay. Well, given the short timeline, I think it might be something that we could approach in our October meeting. I know a lot of public health issues that find themselves before city government and county government have some public health science and best practices behind them, and I think we have had some contribution in this resolution or this law as well. But let me find out about that. I think we have Director Whelan remotely. Any comments from California? Oh, okay. Okay, just for clarification, it's opposition to bringing recreational marijuana into the city limits of Colorado Springs. Did I roughly get that right?
Yes, Mr. President. It would be a statement in opposition. A ballot initiative, which will be on the ballot, and those ballots will be sent out on October 17th. So it would be especially useful to have our resolution out ahead of the ballot drop date, probably by the 20th. Most effective, it would still be good, but a little later, but most effective before the ballots drop.
Okay. Any other comments?
And I'd ask Lori Seago to weigh in related to the process of the board taking a position. Lori, I believe that would be a special meeting for the entire board to take a stance on that prior to the October meeting, if you could maybe help us with the process.
Yes, that's correct. If the board wishes to adopt or consider a resolution prior to its regularly scheduled meeting in October, then we would need to schedule a special meeting for board members to attend and consider and vote on that.
Okay, I direct board members to some of the language in this contract review, which I think very much supports Councilmember Donaldson's position. The coalition chose to focus on cannabis, marijuana, and prescription drugs, opioids among youth, and then it goes on to some of the cautions and difficulties associated with cannabis use and opioid use in youth. I'm gonna pick a nit here, just because this is a really important topic. The contract review spells out prescription drugs, and I would say that prescription drugs include fentanyl, which is widely used in anesthesia appropriately in hospitals, but that the illegal use of fentanyl is, of course, a huge health problem for us right now, and so I just want to include fentanyl in the wording of the contract, because it should be highlighted and noted that public health is specifically focused on the use of fentanyl. Abuse of fentanyl, excuse me. Yes, comment?
I was just going to say, if I may add, the process that we've done something like this in the town of Monument, and what we recommend, what I recommend, is have someone like General Briggs put together an initial resolution of what he would, or if Representative Donaldson would prefer, put an initial draft, and then have it reviewed by the attorney, and then we have the workshop, and then everybody comes together and we do edits on that, rather than just trying to start with a blank piece of paper. We found it much more efficient if someone who who has a passion for the topic would put the initial draft together, and then it can be amended and changed in the workshop, and then it's up for final vote at the next meeting.
It's roughly the way we've done things like that. So let me ask General Briggs, would you be willing and maybe to take an initial crack at this, some wording, and then we could begin to, yes, please.
I'll always speak after the lawyer.
Okay.
Thank you. I would modify that recommendation. I'm happy to exchange emails or have a phone conversation with any member of this body, but I would recommend it would probably be easier to leave the drafting to me, and then we can go from there.
No contest.
Agreed.
Okay. All right. I think there's a vote in here somewhere.
Yeah.
Okay. Any other comments?
I
Yes.
just want to highlight, we got into a totally different issue. I want to bring it back. And we can close out on the other discussion if we have to. But on this, I've been working with Fountain, the Communities That Care in Fountain for 5 years. It's a very worthwhile project, doing good things, community outreach, broad spectrum of the community participating in this and supportive of this, and being driven really with the youth. And so I'm very supportive of this project going forward. And if nobody else, I move to approve the contract.
Okay. All in favor?
Aye.
Okay, let's move to the next one, which is maternal and child health.
One quick question before we go to that one. Do we need a motion to move forward with this resolution that we just talked about?
Well, I think that's going to be correspondence between General Briggs and Lori Seago are going to talk about it.
And we don't need a motion for that. You can just direct me to work with General
Okay.
Briggs, and I will.
Would you please work with General Briggs?
I absolutely would be happy to.
Okay.
I believe the one clarifying question is, do we or do we not want to have a special meeting, however? That would have to be clarified soon.
Yes. Yes. Do you want to have a special meeting before your next regularly scheduled meeting?
I don't think we know enough yet to plan that, and we can do that electronically by planning a special meeting. We can propose that.
Then the only question is, how much time do you need to have a properly noticed special meeting?
I'd have to double check the bylaws to see if there are any different requirements in there. State law requires 24 hours notice, so it's not much.
Okay.
But I want to caution you, and I understand you don't have enough information at this point, but we can't have much of a discussion over email as to whether we're going to have a meeting, because then we're having a meeting over email, and that, without noticing that would violate state law as well.
Okay.
I have a question.
Don't want to do that.
Can we propose that we would have a meeting? It's just not scheduled yet. I know it sounds pedantic, but we just don't know the date yet. But we plan on proposing a special meeting.
I don't know what that accomplishes. Yes.
Lori, how much time do you need to put together a resolution?
Well, unfortunately, I'm out of the office starting Monday for 10 days. So if I can squeeze it in the next couple days, I can crank one out. Otherwise, it would have to wait a week and a half.
Okay.
I will be sure to get with you soon.
Yes, sir.
And Mr. President,
Yes, please.
if it would be helpful, Lori, I'll forward to you the draft I'm working on
Sure.
with staff at City Council.
That'd be
and
great.
It addresses some of the health risks or consequences of additional exposure to marijuana or recreational marijuana.
And I just want to clarify, General Briggs, is that the particular ballot initiative you had in mind when you raised this in the first place?
Yes, it is.
Okay,
And
thank you.
I defer actually to Councilman Donaldson on that on the wording. We happen to be in agreement, and that way we're not creating competing sort of ideas that are out there. It can be modified. If you take a look at that and it can be modified so that it's appropriate for the county, then I would be happy with that.
Sounds great.
Thank you. Okay.
Mr. Chair,
Yes, please.
might I propose tying up this with a little bow and aiming for a potential meeting the week of the 17th? That is the week that ballots will begin to go in the mail on the 17th, probably arriving in homes 2 or 3 days later following that. So might I propose we kind of give the appropriate time to get this right, and then kind of just target a special meeting the week of the 17th. That would be for this sole exclusive purpose.
Okay, well, we have two ways to do that. We can either do it, as you suggested, guidance to staff, or if it needs a motion and a second and a vote. What, Commissioner Bremer, what would you say? Is this guidance to staff?
I think it's guidance to staff, just in busy schedules with busy people. I think it's good for us to keep in mind to keep a 30 to 45-minute window open maybe early that week.
And public health staff will reach out to board members to gauge availability that week and schedule something that most, if not all of you, can attend.
Good. Any other board member comments or questions? All right, moms and babies. Thank you very much. Are you talking about moms and babies also?
I'm talking about all.
You got
of
them all?
I have them all.
Well, go for it.
So I just want to double check. I have Emily Maney on the virtual. She's the program manager for maternal and child health. She's also attending public health in the Rockies. Emily, are you there?
Good morning. Yes, I'm here.
Okay. Emily's my phone a friend if I have some questions. So this contract is the annual renewal for maternal child health. This program has been with El Paso County Public Health since 1989. And this is a navigation care coordination program where we have 6 staff working in the program that are referring families and community partners to connecting resources, carrying out referrals to different community partners, healthcare partners, navigating the system with special emphasis on children, families of children and youth with special healthcare needs. And we also provide education to our community partners and training to different staff internally, externally, in order for these families that may not otherwise have access or don't know how to navigate these systems. And that's what this program is designed to do.
Board member questions, comments? Program since 1989.
Just
Yes,
what
please.
kind of volume? Oh, sorry. What kind of volume do we? How many people generally in a year do we help in the program?
So in terms of training staff at our community partners internally, for this year so far, excluding this last quarter of the calendar year, we've trained over 700 individual staff at partnering organizations and internally on how to extend that connection and navigate and help people manage the resources. And then in terms of families we've served, I have that number. If you just give me a second here. Emily, if you have that at your fingertips, go ahead.
I do. Yeah, so actually we have 3 care coordinators that are serving families of children and youth with special health care needs, and their care coordination clients this year so far is 113. But we don't enroll every family in care coordination, so that's just those are just the families that we've done a thorough assessment, a plan of care with. But we also have quite a few families that we're working with that we're providing just information and resources and helping connect them, but we don't officially have them enrolled in care coordination. So there's quite a large bulk of those families as well that we're just helping kind of navigate systems.
And some of our successes are helping people find housing, access to groceries and food, access to transportation, so that they can remove those barriers in the determinants of health so that they can get the health care that their families need.
Okay. We have a motion?
I do. I'm a huge fan of the block grant model because it allows federal and state funding to come right to our community and be put to use with our families here in El Paso County. I would like to move approval of this contract.
Second?
Second.
All in favor?
Aye.
Aye. Aye.
And on to our third contract renewal, which is also moms and babies.
Yes. So I'm going to have Stephanie and Amber come up. They're my subject matter experts for the Women, Infant, and Children program, otherwise known as WIC.
Thank you.
This is also an annual renewal. And this program, we employ roughly 42 to 45 staff. The WIC educators carry a caseload of anywhere from 550 to 650 clients per month. We enroll around 12,000 clients monthly and around 25,000 annually. This program gives moms, not just moms, even though it's called Women, Infant, and Children. It is a federally funded program. This is where I get into the weeds, and I might need to phone a friend. But there's a criteria for families to be enrolled. They meet the criteria based on income, identity, need. They meet with our educators, and they receive nutrition counseling, breastfeeding education, supports around just mom-baby, and that our educators work with them on a monthly basis or whatever is needed. And this program has been in the U.S. since 1974. I was not able to locate when El Paso County Public Health took this on, but I'm happy to dig for that deeper if you'd like to know. And at the risk of rambling, I'll stop there if you have any questions for us.
Questions about the WIC program? Yes, please.
Do we keep track, or do we have percentages of military families that are using WIC?
Come on up to the mic. Yeah, please.
I don't have that number. We could possibly figure it out. We do have a higher caseload at our South Clinic, which is down on 85, 87. We will have our mobile clinic at Fort Carson soon, so I can definitely pull that number for you. We don't have it currently.
Okay.
Yeah.
And
we do have about a caseload of 12,000 every month.
Okay.
Yeah.
If it's not too onerous to get a rough estimate of what that number is, I'd like to hear it. And then would we give that number to DOD in any way so that they can track what's happening in the military communities with response to this and how communities are participating together?
We can definitely do that, and the military installations have their own public health offices as well that we do partner with, and so we can work with them as well.
Right, thank you.
Yes.
Just a question out of curiosity. The nationally publicized shortage of baby formula, has that presented any challenges for the WIC program?
It has.
The answer is yes.
Yes. And these two, of course, can speak to that better than I can. It has improved with more access to formula and also with some of the federal vouchers that gives a little bit more leeway in terms of what we can provide or what's available. Where we still see a need or issues are in that specialty formula where there could be allergies or sensitivities or those types of things.
And I understand with some that there's a recommendation that all formulas be boiled prior to being given to infants. Is that part of the education? And associated with that, is that because they are being imported and not generated or produced in this country?
Go ahead.
Yeah.
If you.
So probably the more concerning piece of that is the health of the infant. So if they're premature or have immunocompromised systems, it's probably more concerning to boil the formula. When you do boil formula, though, it breaks down the proteins in the formula. That's also a concern. So there is, bacteria in the formula that could possibly be in it if you don't boil it. But it is part of the recommendation in the hospital. So yes, you should be boiling it, but it does break down some of the proteins of the formula too. So it's probably more of a recommendation for your more immunocompromised infant, your premature infant, those infants that we're worried about medically. Okay.
Other board member questions about WIC?
Sure.
Yes.
chair or president over here?
I'll answer to whatever.
All right. A, is that accurate? Is the recommendation that all formula should be boiled now?
Third formula.
That's right. So that's correct. And then 2B is the shortage, the formula shortage, which we discussed here several months ago. Is that pretty much resolved? I think that one big plant came back online. Is that right? Can you give an update on that since it's brought up here about it?
Okay. Mm-hmm.
So we're still having families struggle with finding formula. Probably with your medical grade formula more often than not. So we still are having families not find it in the stores. So it's just an ebb and flow. So sometimes they're having really good luck, and then some weeks not as much luck. Nutramigen is one of our big formulas that we're struggling with. It's more of your hypoallergenic formula that you can shop in the store for. We're having to order it through our pharmacy through the state. So that is one of our difficult ones. It's not one of those, it's not the formula through the factory that shut down. So we're not seeing any of that formula yet from that factory. So we haven't seen any formula come from that factory
would you
yet.
say it's like we're significantly better off now than we were 3 months ago?
Yes.
When it was in
I would say we're better. Yes.
Significantly better. Like it's a lot better now.
I don't want to say significantly, but it's better.
Okay,
yes.
Thank you.
Yeah.
Have a comment?
Mr. Chair, I would like to move approval of this contract item.
Second.
All in favor?
Aye.
Okay, now we're up to our fourth contract review, and guess what? Moms and babies. Let's talk about the Women, Infant, Children Breastfeeding Peer Counselor renewal, please.
Okay, so this is I'm using the correct words, a supplemental contract of women, infants, and children. It's the Breastfeeding Peer Counselor program. And this is a program where we employ staff, looking for that number here. We have 4 peer breastfeeding counselors. This is a program where moms who are wishing to breastfeed, or it's educational, it's support in the moment. It's primarily done over texting and phone. The peer counselors respond to moms in need in the moment. It's available 24/7 on the weekends, and they are have seen great success in increase with breastfeeding, and highly successful. This program has been awarded for its exemplary use of peer breastfeeding counselors, and I'll just open it up to questions as well.
Board questions about the Breastfeeding Peer Counselor program?
Mr. Chair, I'm going to call you Chair for the
President.
President? Okay, it's Mr. President.
Yep.
As a strong supporter of breastfeeding, I'd like to approve this resolution. I've seen how useful that is in our family. When my wife had our first child and our second, but especially the first one, this is not an easy thing to first time. So,
Great. Second?
Second.
Okay, all in favor?
Aye.
Aye. Good job. Thank you. Thank you very much.
Thank you.
Now, Director Whelan, virtually, I guess you get the honor of introducing Janelle McNair as our new Emergency Preparedness and Response Program Manager. And then we have a resolution to read. Please.
Sure. If I could have Janelle McNair and the Emergency Preparedness and Response team come up to the podium, please. I'm excited, and I think that we're very fortunate to have promoted Janelle McNair to our Emergency Preparedness and Response Program Manager. as you remember, Lisa Powell, after serving, I think it was like 30 years with local public health, had retired, and that opened up a vacancy. And Janelle had competed or interviewed for the job and was selected. I do want to provide a little bit of background about Janelle. She has been with our agency since 2016, and she has served in lead emergency preparedness and response role since 2019. Recently, she took initiative to write some best practices on behalf of our COVID response for the National Association of City and County Health Officials, and our agency was selected to further that information to provide a guide for other local health departments around the nation, specifically in the areas of information sharing with our public health data analytics dashboard, our mobile vaccination strategy that we developed and implemented, and then also our Operation House Call, which is a partnership with our fire department and Matthews VU. So we are a model agency in the realm of emergency preparedness and response. And Janelle has a wealth of experience, but I do want to highlight that through the pandemic, she prepared and studied for and received a Colorado certification as an emergency manager. And I think that that's significant because there are, my understanding, very few in Colorado, and we have one of them. And so congratulations on that huge accomplishment, Janelle, and I'd ask you to introduce yourself and your team, and prior to going into our emergency preparedness and response resolution.
Thank you. I think now you can hear me better. Thank you so much. I've been with the agency for 7 years, as Susan mentioned, and I'm absolutely thrilled to be serving in this new role. I am extremely passionate about emergency preparedness and response. And, every emergency out there has a public health component to it, whether we're a lead or a support agency. And so knowing that we are coming to work every day and what we do is important and making a difference is very rewarding. Also have prior military experience as well, so served for nearly 10 years. And so I enjoy continuing to serve just in a different capacity, and am definitely excited about this new role and position. However, let me say that none of this would be successful without the team. This is, we're a small but mighty team, and we feel, we wear multiple hats in a response. And I will also say that we support a 5-county region, so the South Central region of El Paso, Teller, Park, Chaffee, and Lake County. So, this small team does a lot of work out there with planning and training and exercise and evaluation and response. So we are definitely small but mighty, and we are missing 2 members today. Marini Kleber is at Public Health in the Rockies, and Jocelyn Rosado is actually over at Pikes Peak Region Office of Emergency Management, attending a meeting over there, which we work obviously closely with them. So I'll just have each team member introduce themselves. And Aaron.
Yeah. Hi, my name's Aaron Huser. I've actually been on meetings with several of you for Operation House Call. Actually, Chief Colas was very helpful with that, and also Matthews VU. So we appreciate your guys' help. So I'm an emergency preparedness and response coordinator.
Oh, I'm Daryl Kirby, and I'm one of the regional emergency preparedness and response coordinators.
I'm Sarah Adams, and I am the project management specialist for the team. I provide all the administrative support, grant support, all that stuff.
James Baumgartner, I'm the new logistics coordinator, so I'm there to haul stuff for the team. And
we all know how important logistics is, so his role is important. And like I mentioned, Marini Kleber, she's the regional epidemiologist, and Jocelyn Rosado is an emergency preparedness and response coordinator. So thank you.
Well, welcome.
And Dr. Chairbush,
Congratulations. Thank you. Okay.
Dr. Chairbush, I wanted to add something, if you can hear me.
We do.
Yeah, I think it's really important to recognize the entire team at Public Health. After 9/11, Public Health was brought in as first responders, and we have all been trained in the National Incident Management System. And our small but mighty team, specifically that focus in emergency preparedness and response, have provided a wealth of training and coordination, not only to El Paso County, but also support for the 5-county region. And so, as you know, through emergencies, we scale up or scale down, whether it's a hepatitis A outbreak or whether it's a Waldo Canyon fire, Black Forest fire, COVID, H1N1, there's a variety of a list that we respond. And we pull staff from different programs who have been trained to serve in emergency response roles. So I do think it's very important to acknowledge the entire team when we talk about emergency preparedness and response, because every single team member, it does not matter what the position is within our agency, they do have a role and a responsibility to respond as needed. And that's oftentimes other duties as assigned, but also we take it very seriously, and we are intentional about ensuring that when staff are hired, that they receive the appropriate training based on their role or their position. And then we also work very closely with the Pikes Peak Office of Emergency Management and the rest of our first responders. But I did want to mention that because I think that that's very significant and important for our agency. Thank you.
Great, thank you. Well, before I read this proclamation, are there any other board members that would like to speak in favor of our individual, family, and community preparedness? Yes.
I'd just like to say, as the former director of operations for Northern Command, having worked directly with FEMA at the national, state, county, and city level, an effective emergency management team on the ground is what creates success or failure. There's a lot of ideas that float around from Washington down to the state, but it's the folks that are on the ground, you all, that actually make the difference. And I want to thank you for stepping up to the plate, for being good at what you do, because quite frankly, there's not a lot of people behind you in this room. And I mean all of you here in this room, not just the core team, because when a crisis happens, people are going to be looking for answers. And so we have to be ready. And I appreciate your professionalism on that. So thank you.
Thank you. Any other? Yes.
Yeah,
please.
I too want to thank you for all the work that you've been doing. I know the last few years with COVID and everything else has been very difficult. But one quick question I have is that with the talk of food shortages, and Dr. Turbush was mentioning electrical outages, is there a document or website that you recommend where citizens can go to and say, this is the minimum preparation, or this is the preparation we should have for the type of things that might be encountered? We're not going to have hurricanes in Colorado Springs, but there are other things that we need to prepare.
Yeah, absolutely. You can always start with the local Pikes Peak Regional Office of Emergency Management. They have links there on their website to coloradoready.gov. And then there's also ready.gov, which is the federal website. So if you want to kind of dial it down, you've got coloradoready.gov for the state, and then Pikes Peak Regional Office of Emergency Management, which is our local emergency management, also has a preparedness guide on there that you can download, and they also have hard copies. So if you were to go over to their office or contact them, citizens can get a copy of that as well. So,
And Mr. President,
yes, please.
But Janelle, you mentioned like a military background or experience. Tell us which branch that was.
Yes, I was with the Army for 9.5 years, a medical service corps officer and a medevac pilot. But let me say, we have other military members here as well. So,
well, you already hit the important one.
Jocelyn, who's not here, is Army, and Daryl and JB were Air Force. So
very good. And I heard pilot in there.
Yes, UH-60 Blackhawks medevac. So
okay. Any other comments? All right, I'm going to go ahead and read this proclamation, and thank you very, very much for what you do and what you've done and what you will do for our community. Proclamation to the El Paso County Board of Health recognizing September 2022 as National Preparedness Month. whereas preparedness within the field of emergency management can best be defined as a state of readiness to respond to a disaster, crisis, or any other type of emergency situation, according to the Federal Emergency Management Agency, FEMA. And whereas disasters and emergencies often have public health consequences that impact the local jurisdiction, and whereas preparedness is a continuous cycle of planning, organizing, training, equipping, exercising, evaluated, and taking corrective action in an effort to ensure effective coordination during the incident response. And whereas El Paso County Public Health will prepare, respond to, and recover from all hazardous incidents or events that pose an imminent or potential threat to the health, medical, and environmental needs of El Paso County residents. And whereas National Preparedness Month is celebrated across the nation every September to raise awareness about the importance of preparing for disasters and emergencies that could happen at any time. And whereas the theme of National Preparedness Month 2022 is a lasting legacy, the life you've built is worth protecting. Prepare for disasters to create a lasting legacy for you and your family. And whereas El Paso County Public Health participates in National Preparedness Month by encouraging the community to take actions to prepare themselves and their families, children, and pets for emergencies or disasters, such as building emergency kits, making a plan to communicate with loved ones, developing evacuation plans and meetup points with family. And whereas El Paso County Public Health Emergency Preparedness and Response Program also encourages agency and county staff prepare and prioritize personal preparedness. And whereas the Emergency Preparedness and Response Program at El Paso County Public Health provides support and serves all the people in the communities in the south central region of Colorado, to include El Paso, Teller, Lake, Chaffee, and Park counties. And whereas El Paso County Public Health maintains a ready workforce and requires all staff to take incident command system trainings to prepare to serve in first responder roles that they may have in public health or other emergencies. And whereas El Paso County Public Health has taken a lead role in responding to various public health emergencies in the past several years, such as the Ebola traveler monitoring in 2016, hepatitis A outbreak in 2018 to 2020, the 2019 to 2022 COVID-19 pandemic, and the recent 2022 monkeypox outbreak. And whereas El Paso County Public Health has also provided critical support during other recent disasters and emergencies, such as the 2012 Waldo Canyon fire, the 2013 Black Forest fire, the 2013 Manitou Springs flooding, the 2015 Planned Parenthood shooting, the 2018 Carson Midway fire, and the 2019 Regency Tower fire. And whereas El Paso County Public Health recognizes the need for and importance of encouraging the community to take action and prepare for disasters and emergencies that could happen at any time. Now, therefore, be it resolved by the El Paso County Board of Health, the month of September 2022 is proclaimed as National Preparedness Month in El Paso County, Colorado. Do I hear a move to approve?
I move to approve.
Second.
All in favor?
Aye.
Aye.
So this proclamation has been moved, seconded, and adopted by the El Paso County Board of Health at its meeting held on September 28, 2022 in Colorado Springs, Colorado. Thank you very much.
Thank you.
Photo? Yes. Oh, photo op. Okay. All right. Here we go.
Where do you want to set me? The background?
What's that? EPROEM? Sure. Okay.
Thank you. Want us in the middle? Okay.
Oh, excuse me. Or you should kind of.
You're the
Yeah, we'll put the tall guys on this. Here you go.
Thanks, everybody.
Yeah.
Do you know Samantha Cooper?
But we
Yeah, I would think that's what you might know. Yeah.
Okay. That was our exercise. Okay. I think we're. All right. And we're up to our Public Health Director's Report. Susan, what have you got for us today? Please.
Moving right along, we've got a few different topics to provide an update on. One will be monkeypox, and the update will be provided by Dr. Bernadette Albanese. Second up will be influenza. What is the outlook, provided by Dr. Paul Mayer, and then also COVID-19 and a little bit of a focus on the bivalent vaccine. So with that, Dr. Bernadette Albanese, if you're not already up at the podium, if you could go ahead and provide an update, please.
Good morning, board members. This is my first in-person meeting with you. Dr. Albanese, one of your co-medical directors, so it's nice to actually see all of your smiling faces in person. Okay, so as Susan mentioned, I'm going to give you a brief update on monkeypox situation in Colorado and locally. So this is some data updates. So as of yesterday, Colorado had reported 302 cases statewide. 9 of those have been hospitalized. And in Colorado, there have been no deaths reported. There's only been 2 deaths reported nationally, one from Texas and one from California, although I think some parts of them are still under investigation. In El Paso County, we've had 21 cases among El Paso County residents. And on the right side of the slide, there's a table to show you the case counts as they have come in by month. So you can see sort of a little bit of a slow start, so to speak, in our jurisdiction, and then picking up significantly July, August, and into September, although generally improving. Next slide, please. This gives you 2 snapshots of the trends since it started impact. So the outbreak itself started in May of this year, but we're not being impacted in Colorado until July. And so on the left side is the Colorado, what we call epidemic curve. So on the bottom are the dates since the beginning of July. The gray bars indicate the number of cases reported in a specific day. And then that dark blue line is what we call a 7-day moving average. So it sort of smooths out so we can actually follow the average trends over time. And so focusing on that blue line, you can see that you can appreciate kind of 3 distinct peaks so far as the cases counts went up, one in the end of July, into the next one in the middle of August, and then again end of August into September. And interestingly, when you have a disease that's spread person to person like monkeypox is, with a duration of time between getting exposed and getting infected up to 3 weeks, but averaging about 1 to 2 weeks, you sort of see these waves come. So a set of people get infected, and then more people get exposed, the next set get infected, and so it can propagate. And it does, when you have these types of outbreaks, you will see an increase initially until, hopefully in this situation, settles down. And so we are seeing things a little more favorable, but we are not out of the woods yet. On the right side of the slide is our equivalent of an epidemic curve for El Paso County. So those cases reporting in our county towards the middle to end of July, and then we see our cases popping up August into the beginning of September. Most of the cases in the middle of the slide, and then settling down a little bit. Next slide, please. So the persons most at risk, this has remained pretty consistent throughout the outbreak, not only in Colorado, not only in the United States, but nationally. So the highest risk remains among adult men in Colorado and the Denver metropolitan area, so kind of up and down the I-25 corridor, but heavy in the Denver metro area proper, who report sexual contact with other men. So as we acronym use MSM, men who have sex with men. There have been individual cases outside of that, people experiencing homelessness, some cases in incarcerated or detained people, but no spread identified in these congregate settings, which has been encouraging. In El Paso County, our cases have been among male gender. Most of the transmission is expected after the investigation, deemed to have likely been from MSM contact. 71% of our cases are aged 20 to 49 years of age. And just kudos to our reproductive health clinic, where we have been doing clinical evaluations and testing. So we've had 18 tests done. So 5 of our El Paso County positives have actually arisen from our clinic. Next slide, please. So this is a little bit of a busy slide, but there's so many folks to give kudos to. First and foremost, as well as our communication folks who helped me with these slides and have been done a tremendous job helping us get the word out. But our immunization team, so we have a vaccine for monkeypox called Jynneos. I'm going to talk about that on the next slide, but we have been administering over 250 doses through our clinics, whether on-site in this brick-and-mortar location here, in our weekly clinics, walk-ins, referrals, particularly because the vaccine has been used for people who may have been exposed and that prevent them from getting infected after their exposure. And we have had and begin continuing to have more off-site clinics where we work with community partners to provide vaccines out in the community. CDPHE has helped us sponsoring clinics where we've had a little over 280 doses administered, 2 locations also in partnership with the community out in the county. And we have continued upcoming clinics at some of our local bars and also at the City of Hope. So the next list is, I'm not going to go through it in detail, but it's just meant to reflect how much outreach we have been doing and continue to do with community partners, particularly those who work within social networks with the LGBTQ plus population to help us get the word out about risk, at-risk behaviors, things that people can do to reduce their chances of being exposed and getting infected. So there's been a lot of work in this arena, and ranging from layperson community partners through and with our healthcare partners, including Dr. Vu, who's been on several calls with us with healthcare providers to talk about evaluating patients. So this has been a tremendous effort. On the right is just a graphic, one of our graphics recently promoting a vaccine clinic that CDPHE helped us out with at the Pikes Peak Metropolitan Community Church a couple of weekends ago. And I think that's my last slide. Oh, no, sorry, very importantly. So this is the criteria that we're using to use monkeypox vaccine. So the vaccine is called Jynneos. That's the brand name of the vaccine. And it's just kind of a smallpox and monkeypox vaccine. And in this scenario, it is initially had been used. Doses were limited because this is not, obviously, this type of virus is not a virus we have commonly seen and hopefully in the future won't commonly see, moving through our general population. And so this vaccine is was initially being used to prevent infection if someone were exposed. It's not an uncommon public health approach that we do. For example, if people were exposed to hepatitis A and they had never been vaccinated before, we would give them a vaccine to help prevent them from getting from the infection taking hold in their body. So if someone has had close physical contact with someone who had monkeypox within the previous 14 days, we would offer them a vaccine, including in the pediatric group if there was someone in the household with monkeypox. And close physical contact means skin-to-skin contact, intimate contact or sexual contact really of any kind, because the rash is what's infected. This is a rash illness. The rash lesions are infectious, and so when you have skin-to-skin contact, that's how you can get exposed. As of about a week ago, the CDPHE expanded use of this vaccine not only for post-exposure prophylaxis, but now to prevent exposure in advance. So in someone who is maybe engaging in these at-risk behaviors that I've listed on the slide, we can try to provide vaccine for them in advance. And this is a 2-dose vaccine, so we want to try to get both doses in a month's time. So that if they would have an exposure in the future, they would be protected. So this is more the traditional way that we think about vaccine-preventable diseases. It's everything that we do with pediatrics and our flu vaccine that Dr. Mayer will be talking about. But so this is where we're focusing our efforts now, and hence our linkages with community partners to help get this vaccine out. I'm happy to answer. I don't know if we answered questions now or after. Now? Okay.
Questions for Dr. Albanese, please. We are going to have a flu update also.
Yes, flu and COVID.
Okay.
Thank you, Dr. Albanese.
Thank you.
Dr. Vu, you had a question.
Yes.
I'm sorry, don't run away.
And then I only have two questions. One is, can I have your opinion about the improving trend of the reported cases of monkeypox? Do you think is it because of more awareness, or is it because less cases are reported? In my mind, it might be too soon for the vaccine to be that effective. Do you think it's a real trend and it may pick up in the future?
So thank you for that question. It's a great question. I think I can't quantify the relative contributions of the prevention measures that we have been using. So we have education, which clearly has been important. I mean, our responsibility in public health when you have an outbreak is to measure what's happening and who it's happening to, where, and over what period of time, and then turn that information and put it out there so that people understand, especially if they're in a risk group. So there's been a tremendous amount of effort, not just in El Paso County, but Colorado and nationally and internationally about this outbreak. There is data to suggest that the information is making a difference in terms of decision making in persons' individual behaviors. And so there was a study published a few weeks ago from persons who identify as men who have sex with men, identifying that upwards of 50% reporting a change in their behaviors in terms of their sexual behaviors, which is a huge difference. And so I think that's definitely making an impact. The Jynneos vaccine has never, we haven't had a monkeypox outbreak. There's 56,000 cases nationally, 25,000 cases in the United States. We've never had a monkeypox outbreak like this. I mean, this is not a brand new disease. It's been endemic in other parts of the world related to exposure to disease in animals, but not this person-to-person trend. And so we didn't come into this outbreak with a clinical trial saying when you have a monkeypox outbreak and you use Jynneos vaccine, it will do X, Y, and Z. Those studies are underway now, but because of how similar monkeypox virus is to the smallpox virus, it was expected that this vaccine would have an effect. And when you take this virus into the laboratory, take people who have been vaccinated, their blood into the laboratory and test it against the virus, it tells you that there should be an effect. There will be a release, hopefully, you caught me a day or two early, Dr. Vu, but by Friday we're expecting a release of some very provisional data that the CDC has been compiling from 32 states, including Colorado, about some real-time vaccine performance in this outbreak. CDC had to keep it very quiet, except they had a smile on their face and said the results are favorable. So I'm expecting to hear some good news. This is still not a traditional vaccine effectiveness study that is also ongoing, but we think that the one dose has had an effect. All that said, and that is good news, and we have a tremendous amount of effort to try to get people at risk vaccinated. We want folks to get the second dose. We had to have an effect by the first dose, but by no means have this vaccine coverage penetrated all of the at-risk persons in El Paso County or Colorado or around the nation. So it's not just the vaccine, because we haven't used enough of it to say that we can totally protect anyone who might be susceptible and at risk for that. So I think it's a combination. The concern that is being raised is that now that things are settling down, which is good news, of course this is an outbreak, we want it to be over, will behaviors reflex back and be less cautious because the perceived risk is down? So I think we have to be careful in October. Again, we sort of see these 2 to 3 week kind of waves to see if in October we actually start seeing an uptick, because persons either say, I got my one dose, I'm one and done, which is not what we want them to do. We want them to get the second dose, or we have a change in behaviors such that we have another sort of set of individuals that may get exposed again and get infected. So we'll see. I think time will tell. I think probably October is a key month to help us distinguish that and to continue to try to get more persons vaccinated. That's why shifting to this get vaccinated before you get exposed is so important, so that we can try to get ahead of it. I hope that answered your question.
Yes, thank you. And the question is reinfection and et cetera. My second question for you is just a curious question. The 2 deaths that have occurred in the United States, do you know the reason for those deaths? Is it directly from the infection, or is it complications such as infection?
For confidentiality reasons, they really haven't, and it's only 2 persons, they really haven't released anything. any detailed information. What I can share is just some very general information about our hospitalized cases. We've had 9 hospitalizations in Colorado. 7 of those were deemed related to be due to complications of monkeypox, and the other 2 to be, well, they had monkeypox with other issues, and so a little hard to tease it out. The complications of monkeypox have included, just a week or so ago, Colorado and Washington, D.C. published a case series in the CDC Journal about 2 individuals, one from Colorado, one from D.C., who had severe neurologic complications actually from this infection. They had monkeypox lesions in their brain and in their spinal cord. So that can happen, rare but clearly severe. I think those individuals survived, but still, you can imagine a prolonged, complicated hospital stay. Pain is, these lesions are painful, and depending on where in the body they are, you can have lots of complications around managing pain. The rash, if severe enough, can also cause strictures, and so if the rash is on membranes, say of the mouth or even in the anal area, you can have strictures and have significant problems there. And so, we are particularly concerned about people who have weak immune systems who get this, people who are HIV infected and get monkeypox. We haven't had a case in pregnant women, but that would be a concern. Very young children, that would be a concern. There was a case actually in a 2-month-old child in Florida because a caregiver in the household had monkeypox, and just from infant caregiving, that baby ended up doing well, but it was certainly an eye-opener and a scare. So I don't know what happened exactly with those deaths, but would suspect that there might have been some underlying conditions to make the course of this viral infection more severe.
Thank you, Dave.
Thank you very much.
Hey, thank you. Update, Doctor. The 9 hospitalized cases made a really good point that an immunocompromised person, much greater risk. Do we know, were they all immunocompromised?
They were not, but I'm not really at liberty to give more details than that. They weren't. Some were, but not all.
Some were. El Paso County, how many cases total?
We've had 21.
All males?
Yes.
All males. And then in the state, it's not that important, but what's our total number in the state?
302, and in the low 90% are males.
Oh, okay. And those were my questions. Thank you.
You're welcome.
Any other board member questions for Dr. Albanese? Thank you. Very good. You're okay. And flu update. Dr. Meyer, welcome.
Thank you. So I'll give a brief influenza update. So Paul Mayer, co-medical director. Currently, influenza is not very active in the state. Typically is not usually in early October. Typical flu season is defined by CDC as October through May, although the true disease activity usually is more narrow. Usually it's late November through March. Usually by the end of March it's waning a fair amount. Last year we saw an odd flu season where it lasted into June, probably related to COVID behavior changes. And then in the last 2 years, we've seen very little influenza in the state and nationally, again, due to COVID-related behavioral changes. It's a reportable disease for any hospitalizations or pediatric deaths. And of course, we recommend getting a flu shot, influenza vaccine. It's a common question, what's in the flu shot? So I'll mention there are 4 strains of influenza in the vaccine, 2 directed against influenza A and 2 against influenza B. There's also 3 new vaccines for people 65 and older that are considered to be better flu vaccines and create better immunologic response through different mechanisms. And then, as you probably know, flu shots are widely available. They're available through us, but also certainly through pharmacies and major hospital systems. And then, next slide. It's been in the media, so I thought I should just talk about the experience in Australia. Their flu season is offset from ours, and we kind of look at what happens in Australia, just trying to predict what's going to happen in the U.S. And their flu season was the worst in about 5 years, so it wasn't a catastrophic season, but it was certainly worse than usual. And so there is some concern that we may also have a worse influenza season this year than we've had in the last few years. This is believed to be due to a combination of less natural immunity because overall fewer people have been getting influenza in the last few years, and also relaxation of the COVID restriction. And again, best strategy is to get your seasonal flu vaccine. And then when you're there getting your seasonal flu vaccine, next slide, we'd recommend you get your bivalent COVID vaccine in the other arm. So you probably know, and the next slide, COVID bivalent vaccines are out. They're a bivalent vaccine. Half of the vaccine is directed, or is the original formulation, and the other half is directed against BA4 or 5. Currently, they're approved for everybody age 12 and up, but we are expecting and in fact are pre-ordering for age 5 and up. We're expecting around October 10th that 5 and up is going to get approved by the CDC. You should get a bivalent vaccine if you're at least 2 months out from any of your last boosters. It's been very confusing as far as the guidelines on boosters and first and second boosters, and this makes it a lot simpler. Basically, if you're 2 months out from any booster, get your bivalent booster. Or if you're at least 2 months out from your primary series, you should get a bivalent booster if you're in the approved age groups. And those are also widely available. They're available through us. They're available through local pharmacies, hospital systems. The data on that, I think it's important that we kind of accurately say what we know, which is that there were some antibody studies, and it does look like they generate about 1.5 times the antibody response as the original vaccine. But we don't have real-world data to tell you how effective will be. That will have to come with time. And then next slide, I think that maybe, yeah, that was the last slide. So any questions about influenza or about the bivalent boosters or COVID in general?
Yes.
With the influenza, you mentioned with Australia, more severe. When you mean severe, do you mean higher spread, higher numbers, or
just more numbers?
People
yes.
were sick
Yes.
worse?
Just more numbers.
More numbers. Okay, thank you.
Correct.
Dr. Mayor, thank you. Can I have a few questions also? Sure. Can you also clarify some of the very, very common questions that people ask?
Yes.
What is the ideal time for the influenza vaccine, or should people try to predict when the peak is and try to time it?
Yeah, so typically right about now, October is sort of the best time to get your flu vaccine. It's always nuanced, though, so you know it can vary year to year. If we're having an early influenza season, then you actually might want to get it sooner. But yeah, October is a great time to get your flu vaccine.
Okay. And does immunity to influenza vaccine last throughout the season?
Yes, there's some evidence that may wane, which is why they now say it's good to get it maybe in the fall rather than like in August. So there is some waning, but yes, especially if you get it now in October, it should last hopefully through the season.
Okay. Thank you.
Oh, sure. And
any other questions? Yes, Commissioner Bremer.
Thank you. One quick question. Given the different age recommendation for the Pfizer versus Moderna ages, which one is carried in the El Paso County health clinics, and is it both at the vaccination?
I believe I'll have to defer. Christy. I believe we have both, but I want to make organizations.
Thank you. Sorry, put you on the spot. Hey, we carry both in our clinic, so we'd be happy to serve anyone with an appointment. Sure. We carry both bivalent boosters in our clinic.
So anyone 12 and older can come to those clinics, and we will be able to do the one that's appropriate for them.
Correct.
Thank you.
Mm-hmm.
And then you probably know you can mix and match, and so that's also fine.
Thank you.
Yes. Councilmember Donaldson.
Thank you, Mr. President. Thank you for the presentation. Besides getting an influenza vaccine, can you touch on some things citizens can do to make it less likely that they will develop influenza?
Yeah, absolutely. You know, we've seen, we have great data to say that all the things we did to prevent COVID worked tremendously well at preventing influenza. The first flu season when COVID was really raging and we had pretty strict restrictions, we had very few influenza cases. It was remarkable. Also, RSV was minimal in the nation. So yeah, all the basic hand washing, social distancing, common sense of if you're sick, don't go out, don't go be around people who are sick. And although I know they're unpopular, masks do really help prevent infectious disease. So yeah, those things make a great deal of difference. Absolutely.
Do people's diet, their vitamins, sleep, do those things have an effect on your susceptibility to diseases?
Sure, absolutely. Yeah.
Can you touch on some of the things that you would recommend?
Sure. So, yeah, sleep deprivation has been studied in medical students. Yeah, they're able to demonstrate your white blood cells don't work very well when you're super tired. And so, yeah, good sleep is critically important. Good nutrition, healthy nutrition is very important. And obviously things like, overuse of alcohol, things like that are terrible for your immune system. And, we know from COVID, trying to work on your weight, trying to keep your BMI at a healthy level, all those things matter a great deal for health. Yeah. Sure.
Thanks.
Good. Any other board member questions? Dr. Mayor, great update. Thank you very much.
Thank you.
Appreciate it. Okay, I think we are.
Can you hear me?
Director Whelan, any other reports for us, please, or any personal comments?
Yes. I just wanted to comment also on Mr. Donaldson's questions. I think that those are fantastic and speaks to, why we have a Women's Infant and Children nutritional program, because we know how important some of the many aspects are to our health. So I think that stands out, and so thank you for that question. I did want to mention that as we're gearing up to enter into colder weather and respiratory illness season, that we have vaccines at our clinic, but we are also trying to meet people where they are to provide easily accessible vaccines. We are partnering with District 49. We've partnered with that school district for numerous years, and we will be holding a Boo to Flu vaccine clinic and clinics with District 49, as well as providing vaccine at the National Alliance for Mental Illness Walk. I believe that event is happening on October 8th. Last year we ran out of vaccine, and so it was a really good event that we were able to reach people, and we will be providing influenza vaccine as well as COVID-19, the bivalent vaccine. So I think that that's really important. And one more thing that I did want to mention and highlight that doesn't have anything to do with these diseases is that I am very excited to announce that Michelle Byerly, our Public Health Information Officer, has been selected as a Mayor's Young Leader Award finalist. And so I think this, she's often quietly in the background, and, she's taking photos and, those kinds of things. But, her leadership over the past, couple of years since she was promoted to the Public Health Information Officer has really stood out. And I'm very excited that she was selected to be a finalist with Mayor Souther's Young Leader Award. So I did want to recognize her for that because I do think that is significant. We also had another finalist last year, Christy Durbin, our Immunization Program Manager, and we do have some quality, high-level performing staff. So I did want to provide that recognition. And I also wanted to ask Commissioner Bremer if she wanted to mention anything about the NAMI walk.
Yes, thank you. I will be attending the NAMI walk. I am walking with front end of preventing mental illness before they end up seeing him in an unpleasant situation. As a tip of the hat to his work in the mental health field on the front end, I will be joining his team. I think I was the last person to get a flu shot at that location last year because they did run out. But I'm hoping that my fellow Board of Health members would be interested in joining us on Saturday, October 8th, and anyone else interested, you can find information on the NAMI site.
Great. Good recommendation. Thank you, Director Whelan. Any other? I will note that Councilmember Tom Strand was here earlier. I thought we might hear from him, but I think he had to hurry off to another meeting. So any other board member comments, please?
Michelle, I'd just like to say thank you so much for all your work and congratulations on that much-deserved nomination for that award recognition.
Nice. Okay. Any other saved rounds? No? Okay. This meeting is adjourned.